or right?
Hanging is what?
Yeah, his left is left eye. Yeah, his
Left upper.
yeah, his upper
Eyelid?
In the right iliac fossa.
you see, it's different. The left and the right eye.
What else is happening?
Sure.
What makes the pain worse?
You're only trying to look to the doctor and talk, maybe that's why. Because the doctor is
Yeah, that's
the
possible. That's
yeah.
the way he looks. Yeah. It's straight ahead.
See, basically he has a behavioral problem, you should understand that.
Yeah, yeah.
And that is why, see, his behavior is not normal.
Yeah, of course.
Are absolutely cold.
Is he a retarded child?
Not retarded, Rene, but just see,
His pulse is 81 per minute.
you see the type of pant he is wearing. See, this is how the Mandarin patients usually wear, the dragons and snakes and things, very zazzy type, you know?
Kind of,
Yeah, they're very zazzy people.
Sorry, what did you say? Very
Zazzy.
zazzy.
Yeah. J-A-Z-Z. Now let us see the important symptoms which are worth taking in this case. This is very important that his legs were always drawn up, you know.
Yeah.
I cannot fully see them. Can you read them?
Yeah. Difficult.
Abdomen pain, lying back.
Yeah.
Yeah. And abdomen pain, turning the body.
Abdomen pain.
Walking when compels. Abdomen pain walking while. Abdomen pain, inflammation, appendix. Abdomen inflammation, appendix acute.
Appendix.
General side line on painful aggravates.
What lying on?
Painful side aggravates. Extremities, coldness, fingertips.
He took a lot of rubrics from abdomen pain. Eh?
Yeah.
Yeah.
See, now what is most important in this condition is that there is an inflammation in the appendix. If you don't control it in the right time, the pathology will advance. So this is more important for us to know. That with homeopathic medicine, are we in position to find out the right medicines for this man? Well, if we can do that, we have done our job. Now, it is a very misnomer amongst the homeopathic physician that the disease has to go in the reverse order how it came, what is known as the Herring's law. First of all, it is not a law, it's a misnomer. Herring's law is an observation. There is a difference between a law and observation. The reason is that there are so many patients who improve and they never follow the Herring's law or Herring's pattern. So if there is a law, then nobody should improve. Secondly, the observation regarding Herring's law was observed in chronic cases and never in an acute cases. So one should never try to break the head in trying to observe in acute cases such condition. Rather, as a homeopathic physician, your duty should be that how best I can try to reduce the agony and how fast I can reduce the agony. In an acute condition, it is very important to separate out those symptoms which do not belong to disease or which rarely belong to disease on one hand compared to those what belongs to disease. Now in this totally 13 rubrics that you have taken, I am sure there has to be some symptom which do not belong to disease. Now let's start from the very most important thing. His speech was soft. We all knew that. He was trying to play with the lips. We all knew that. There were some gestures in this particular person. We all know that. This has nothing to do with his illness. So there were some amount of grimaces.
Grimaces?
Yeah, grimaces. So this is very important that it is outside the disease. If you see the modalities of the pain, they are very, very common to the illness, because all appendicitis person does not want jerk, they do not want motion, they cannot walk, they cannot exert, they cannot lie on the painful side. During the pain, the legs always draw up. So here we had nothing more left, Another very important part is the causation. Why did this appendix come? We tried to ask many questions to the father and the patient's mother, but we could not draw any conclusion why this thing had to start. The only reason that we could get over here was the examination. That there was an examination approaching, and maybe, as I told you earlier, that this child has got very poor performance in the school, and maybe that is why this could happen. This was the only reason that we could try and gather over here. So in this case, because the mental symptoms are not very strong, we did not take into totality. But not taking a symptom into totality doesn't mean that we are not going to use the symptom, but we may use it at a later time when we are going to differentiate two common remedies. So this is also very important. That in acute condition, it's not always necessary to take all the symptom into repertoration. We may keep some symptoms which are not so important at a later time to differentiate the remedy when there are more than one remedies coming up. Now in this situation, 3 remedies came up very strongly. One was Bryonia, second was Colocynth, and third was Rhus. So 3 remedies came up very closely over here. So we had to differentiate them. Now, amongst the 3 remedies that are in front of you, remember Rhus is one remedy you should always think of whenever there is a suppuration, when there is septicemia. In the beginning stage, it would have been Bryonia. Colocynth comes as the middle stage and Rhus tox comes at the last stage. So Rhus tox is usually reserved for those conditions where there is an element of septicemia, and Bryonia should be reserved for those conditions when the disease has just started. I think so Bryonia was the remedy which the child required on the first day when he came to our clinic. But because we decided to keep the person on observation, we could not give Bryonia at that particular time. Also, if you see over here, that this person basically allowed us to examine him very comfortably, and even though there was an element of jarring and cannot lie on the painful side, the intensity of these symptoms were not very strong. Now in Bryonia, please remember that the intensity of jarring and worse motions are to its very great extreme, which was not there in this patient. And hence, this was one differentiation why we never thought of Bryonia in this case. So the choice basically then ultimately boiled down to, should we give him Colocynth or should we give him Rhus tox? Now another very important difference that we could gather in this patient was the type of pain. Now in Rhus tox, the pain that one tries to usually get is of a sharp, pricking pain. This is very important in Rhus tox. A very sharp and a pricking pain you will get. The Rhus tox has got a marked affinity for pain in the umbilicus. Please remember, the umbilical pains are very characteristic of Rhus tox.
So the umbilical pains improve?
No, in the Rhus tox has got marked affinity for pain in and around umbilicus like Vereter Malp or like Sina. Then another very important aspect in Rhus tox is the griping pains, The pains are very, very griping in...
Gripping.
Yeah. Many symptoms of the Rhus tox comes after eating in the abdominal problem. First, eating after. Now many people feel that Rhus tox is always better by motion. So why we give Rhus tox? But please remember, in repertory, Rhus tox is even worse motion. So if you see abdominal pain, motion aggravates, or abdominal pain, griping motion on, you will also see Rhus toxicodendron. Then let us see Rhus tox are basically very thirsty patient as compared to Colocynth. But this person, as I told you, did not mention any thirst to us. Now, let us see some characteristic of Colocynth, which normally we see. Now in Colocynth, usually one gets a definite history of mortification, anger and excitement as a premonitory or precursory symptoms before the pathology starts. And in this particular case, this was absolutely lacking, as I mentioned to you. Now here comes a very important aspect of anticipation. That Rhus tox is a remedy which is mentioned in anticipation, but Colocynth is a remedy which is not mentioned in anticipation. And as I mentioned to you, this child was having an examination in just few days. And maybe that is why he was worried that he could not do well in the examination. Many symptoms in Colocynth, some unique thing I would like to say, has to do with coffee. Drinking coffee in Colocynth always gives a good relief to the person. And consuming coffee also produces a lot of problem. In Colocynth, the pain is always very severe intensity wise compared to Bryonia and Rhus. So the pain intensity is always worse in Colocynth, 3 marks intensity wise. The way I told you, motion and jarring are always intensity wise worse in Bryonia. So you will see that Rhus comes always in between this. So in Rhus neither the pain are so severe, neither the jarring is so worse, neither the motion is so worse. So Rhus comes in between the intensity of the common symptoms of appendicitis, especially in a later stage and not on the first day. With this understanding, we gave him Rhus 10 mg, 1 dose, to be repeated every 2 hours. Then we kept the person on a liquid diet. We prescribed the medicine at around 6:30 in the evening, and around 9:30, I myself went to the patient's house to examine his blood pressure, his pulse. Now, pulse is very important to examine because a high pulse rate indicates that there is a septicemia. So you have to see the pulse rate and you have to monitor the pulse rate, which is very important. It is a rough estimate, Patient on that night was only given fresh lime juice and nothing else was given, even though he was feeling hungry. And next day early morning, we had taken a sample of blood to be examined to find out whether there is any element of leukocytosis or not. Next day morning again I examined the child. On physical examination, one should try to touch the part of the right iliac fossa, and see whether there is a presence of any tenderness or rigidity into this. Passage of stool in a case of appendicitis with relief of pain definitely indicates that a person is feeling well. Reduction of pain is a very important indication. When you palpate very deeply and there is absence of any tenderness is a very important symptom in appendicitis. And definitely improvement in the blood count, improvement in the fever, all this goes in favor of what is known as the improvement part. Now what happens over here in this case was that this particular attack got over very nice. And then the parents asked me a very $1 million question, that next month you are going abroad and suppose if this attack occurs, then what should we do? Now this is very important. That I said, look, till I am there, in my presence I can assure you that I can always help your son. But in my absence, I am not very sure. You can trust any doctor and go and take homeopathy. I have no objection for it. So the patient said that no, we don't want to go to any other doctor. And then I said that in that case, if the child has any problem, you rush him to hospital and get his appendix operated. Because this is very important, that once a person gets an attack, the second attack can come anytime unless and until you have not treated him quite long enough. Now in this case, if he has not got himself operated, then definitely we are going to repeat his constitutional medicine, that is the medurinum, and maybe that should take care of his recurrent attack of appendix. I have used one remedy with a great success in my practice for recurrent attack of appendicitis, and that is Psychotico.
Psychotico?
Yeah, Psychotico is a bowel nozzle. It's a bowel nozzle. Another very important remedy that we have seen in our practice is lachesis. Now lachesis and Rhus talks, as I had mentioned to you earlier also, they always come into play whenever there is an element of what is known as a septicemia. So in acute appendicitis, you can write down the remedies which come to your mind is Bryonia, Rhus talks, Lachesis, Colocynth, and one very nice remedy which I think so you all should know about, because without studying this remedy you cannot complete your study, and this is iris tenax. This iris tenax is supposed to be a specific in homeopathy for appendicitis.
What are the indications for iris
Yes.
tenax and psychotical?
Yeah, I will tell you. For psychotical, there are no indications at all, I would say, because it's difficult. For iris, definitely I will like to tell you. Now, as you know, in iris tenax is not a very well-proved remedy. So you have to basically go to the general symptoms of iris if you want to prescribe iris tenax. To me, in iris tenax, the most important symptom which it shares with Bryonia is homesickness. And the second important symptom which I look for in iris tenax is aggravation in the evening. Many symptoms of iris tenax are worse in the evening, that is at 3 o'clock in the afternoon, 3 p.m. and 11 p.m.
And
11 p.m. And typically the person shows the abdomen, the lower right iliac fossa is the most tender part, and there is only other mental symptom which I know of, which it shares with aconite, is a delusion he is going to die. So if you find with an acute condition a person feels that he is a delusion, he is about to die, it shares with aconite, and that is iris tenax. And the homesickness. So these are the things which you should know for an appendix.
Thank you.
Thank you.
thank you.